Allow me to introduce myself. My name is Bea. I am the CEO and co-founder of Uniquely Health, and I'm very happy to have you all here today to join us on the aim of gaining a better understanding of the role stress plays on our body and how we can manage it through exercise and nutrition. Delivering our presentation today will be Anna, who is our dietitian and will be sharing her expertise through the diet perspective, and Sabine, who is Uniquely Health's exercise scientist and will be talking through about what we can do in terms of exercise to manage stress. Before we get the ball fully running, I would love to first introduce what is and who is Uniquely Health and what we do before we get into more detail about stress and how to work around it. So Uniquely Health has arisen at a time that I think we're all hearing more about preventative healthcare and the importance of it. You can see this quote from the Secretary of State of Health and Social Care, who said, prevention is fundamental in order to live longer, healthier, and more independent lives, which is very aligned with our goal, which is to help people to live a happier and healthier life. And so how do we at Uniquely Health do this? Our values are to help people prevent and work in that field by delivering personalized, data-driven, and holistic healthcare and well-being. So our plans that we work with people are personalized to them through the data that you share with us, and it's holistic through our team actively collaborate together. So rather than having to speak to many different specialists and going to one place for a dietitian and someone else for an exercise insight and someone else for the clinical insights, our team work together, discuss your case together, looking at your data, and then work backwards to give you a personalized health plan from their expertise based on your data. So everyone's plans are truly personalized and tailored to the individual. And through this, our goal, as I mentioned earlier, is to help you feel better and stay healthier for longer. So let me give you guys a quick case study of someone that we've had and how it worked for them, this personalized, data-driven, and holistic well-being. Okay, so we had a female who was perimenopausal. She was really struggling with weight loss and had been struggling for a few years. No matter all the diets and the different attempts she tried, she would lose 1 kilo and then it would find her again. And it was this very unsustainable change that was taking a toll because she was actively trying to get better and to lose the weight, and she couldn't. She joined Uniquely Health and we did some blood tests. We found out it was all healthy, all okay, but we found out there were some areas to optimize. And together our clinical team worked and created a plan that worked for her. She went from being someone who hated working out, despised it, to finding a routine that helped her stay motivated and to incorporate more movement in her life in a way that works for her. And through, with Anna, our dietitian, she was also able to get a tailored meal plan based on her eating habits, based on what she likes to eat, that really helped to make that weight loss change sustainable. And through that, we've seen her lose 3 kilos in a way that's sustainable and continue to lose weight in a way that she feels empowered. And I want to focus on that word, that empowered. A lot of times nowadays that we see with healthcare and preventative health being, there's a tremendous amount of fear mongering. You just have to go into Instagram or any news outlet and anything and everything that we eat and do is somehow not good for us. And data can be very liberating, but it can also be really fear-inducing, especially when you're trying to be preventative. And core to the team at Uniquely Health is that we really want to help people being empowered and to understand their data and to understand how they can manage their risks and how they can use it to live their happier and healthier lives. So our team really work carefully and diligently to help you with that sentiment of you are in control of your health and well-being, and we're here to support you. So beyond having this fantastic team that is there ready to work with you, we've also spent a lot of time in creating a dashboard and soon to be released mobile apps that allow you to track and see your progress over time. And it works two ways. Our clinicians can also see this data from you and get real insights that allows them to keep targeting those plans to you. So here you can see some screenshots. You can see in the case of someone who's had diabetes, and over time you could see their HbA1c results, which was their risk of diabetes, and you can see it going down over time. And that I find quite motivating. So if you're ever quite tempted to go and get that extra KFC or go for the extra jar of cookies, you have that visual aid there to help you see that your change is being noted. We also have this exercise feature here where our clinician can see where your heart rate is in different zones, which really allows them to target their exercise plan for different areas. And Sabine will be able to answer any questions you have in that area. And through the app, you can see also this personalized health plan that is completely tailored to you. So our team really work closely with you, and part of our mission as well is to help forever raising awareness and understanding of things that we can do that aren't actually that difficult. And so it's with great pleasure that I now will pass it over to Anna, who will start to explain what is the science of stress. And afterwards, we will have Sabine talk about what is the role of exercise, and we'll go back to Anna, who will talk about the role of nutrition in this, and you'll see me again at the end, just giving you some concluding comments.
Thank you, Bea. Hi, everyone. This is Anna. I'm a dietitian here at Uniquely Health. So I'm going to talk first a little bit about the science of stress. I would like to start basically with a poll question for you. How many people in the UK do you feel have felt stressed at some point over the last year? Somewhere between 50 to 60%, 60 to 70%, or 70 to 80%. Okay, so we already have everyone's votes. Thank you for that. And 90% of you said somewhere between 70 to 80%, which is the correct answer. So well done. Actually, if we look into the data, we have the evidence that says that around 74%, in particular of UK adults, have felt stress at some point over the last year in their life, feeling overwhelmed or unable to cope. So thank you very much for that. Okay. So if we start with describing what stress is, pretty much we might have an idea of what that is between us. In more scientific terms, stress is a state of threat for our body's homeostasis. This is what we call the internal dynamic balance in our body, and any physiological or behavioral change that can cause by either internal or external stimuli, which are the stressors in our environment or inside. We have two different types of stress. So that can be, we can experience acute stress, such as when we're having an argument, or chronic stress, whether we're having an ongoing stressful situation at work or in our home environment. And it's the chronic type of stress that we have to be more mindful and careful for, because that type of stress can impact our physiology and lead to pathologic conditions longer term. And as we will see later, there's different body systems that are involved and interrelated during that process. And I would like to start with the types of stress in terms of positive and negative, because most people think that stress is a bad thing, it can be only negative, but actually there's two sides here that we have to mention. So we have the positive stress, or eustress as we call it, and this is the type of stress where it makes us feel more focused, more energized, when we feel we're being more challenged, such as when we get a new work, job promotion, we're getting married, or we have a child, going on vacation. And this is the type of stress that we see we're in our peak when it comes to performance. Well, we also have the negative type of stress, which is what we call the distress, where we can find ourselves feeling more fatigued, exhausted, or that can even lead us to a burnout. And for example, negative stress or distress can happen in cases such as going through a divorce or death of a beloved one, going through unemployment, being under abuse or neglect, and so on. So we have two different types of stress to be mindful of. If we go into let's say, this complex stress system, I will try to talk about it in simple terms, this basically explains the physiological process that takes place under stress in our body. So we have either the psychological or the physical stressors that cause us to be stressed. So there we have the activation of a stress response, where two main systems, one is the hypothalamus pituitary adrenal axis, and the other one is the sympathetic adrenal medullary axis. So these are the two main systems that get activated in our brain. And then the stress response can lead to specific body and brain changes. For example, energy mobilization, changes in our immunity, inflammatory conditions, suppression of the digestive and reproduction systems, and more. And all these effects, all these changes can lead to changes in our physiology and our behavior, which then our body is going to use to get us back to the adaptation mode. So it's kind of like a cycle of change and adaptation process. If we go into the next slide, I don't want to focus too much on the science behind that, but it's important to mention that these two different systems, the SAM and the HPA, are involved in different changes in our body. If we focus on the first one, which is the fast response, so when the first system that is activated when we're under stress, this is where secretion of different hormones such as the well-known adrenaline is getting released. We also experience quickly after feeling stress, we might experience high blood pressure, rising blood pressure, and our heart rate, but also release internally and release in glucose and fats, such as increased oxygen consumption. So this is when we suddenly feel that we need to breathe faster. And that can also lead in an activation of different behaviors, such as feeling we're more alert, we're more likely to pay attention on details, and so on. And then we have the HPA system, or the slow response system, where other hormones such as cortisol, which is the main stress hormone we're going to focus more on later, is activated. But also we have other hormones that lead to mobilization of energy stores, suppress insulin and our immunity and inflammatory response. And as a knock-on effect, we can have delayed wound healing from a clinical side. If we move on to the next slide, Sabine, that's over to you now.
Thank you so much, Anna. So my name's Sabine and I'm the exercise scientist here at Uniquely Health, and I'm going to speak about the role that exercise can play in the stress response. So what actually is cortisol? Cortisol is the primary stress hormone in the body, and it triggers what we call the fight or flight response, which is very useful from an evolutionary perspective. For example, if someone were to hide behind your door in the office and you walk in without expecting them to be there, and they jump out at you, it's going to initiate a release of cortisol, adrenaline, and the activation of the fight or flight response, because your body's responding to what it perceives as danger. When an acute threat arises, it aids survival by increasing alertness and priming the body to react quickly and defensively to the threat at hand. In doing so, it actually diverts energy away from low priority processes, such as suppressing the immune system and digestive systems, and actually increasing the amount of glucose available in the bloodstream. And just to be clear, the body can be put under both mental stress and stress within the body. So mental stress may be things that we experience every day, as Anna talked about, things like going through stresses with your family, or getting a new job could be a stressful time, or it can be going through stress within the body, which might be exposure to viruses and that sort of thing. So just going on to the next slide, cortisol could be an extremely useful hormone from a survival perspective and prime the body to act quickly in response to perceived danger. However, exactly the same stress response can actually be really problematic if it becomes chronically elevated. So overexposure to cortisol and other stress hormones disrupts your body's natural processes and puts you at risk of a number of health concerns, including obesity, chronic inflammation, unbalanced glucose levels, and sleep disorders as well. This slide here outlines some of the effects that chronically elevated cortisol can have on the body. One of those most important of these is the increased risk of blood pressure. This is particularly important because chronically elevated blood pressure can put your cardiovascular system at under huge strain, and can actually lead to the increased risk of things such as cardiac events, like having a heart attack. Anna's going to go into a bit more detail later on in terms of the role of stress on weight gain, which is quite important to us at Uniquely Health, and how we can make the right food choices to manage stress levels. But going on to the next slide, I'm now going to talk about the effects that exercise can have on stress and how we might use it as a tool to manage stress levels. First of all, we'll just begin by a quick poll. So question for you all is there a relationship between chronic stress and weight gain? So the second answer, 89% of you got this right. Yes, there is unfortunately a relationship between chronic stress and weight gain. And again, Anna will go into this in slightly more detail as we go forward throughout the presentation. So I'm now going to speak about the role of aerobic exercise. So what are the benefits that exercise has on the body in relation to the stress response? To begin, whilst cortisol and adrenaline become elevated whilst you exercise, so actually we need cortisol and adrenaline as part of our response and priming the body to exercise. But actually what happens after you finish exercising is that there is a reduction in these hormones, which can have a calming effect on the body. You've probably all also heard of the word endorphins before. What exercise simulates are the production of endorphins, which are responsible for the runner's high and feelings of relaxation and optimism. This may feel foreign for some of you who aren't a fan of running, but actually it is a real thing. And the endorphin release that you get when you're running, if you get properly into it, can be really notable. And this is generally in line with feeling better and more positive about yourself. Exercise can also help to lead to weight loss, which for some people may be their goal and may play a big role in self-confidence and how you feel about yourself. Power walking and jogging are prime examples of exercise that can be done, which could be considered as aerobic exercise. And finally, exercise is also really important for people with chronic fear and anxiety. So overall, just coming on to the next slide there, exercise plays a really important role in not just the body, but the mind as well. Research has shown that aerobic exercise actually has antidepressant and anti-anxiety properties and protects against the harmful consequences of stress. And it can also actually give us physical time out of our daily day-to-day stresses. For example, if you've had a really stressful situation at work and you actually take the time to leave your desk, go away, exercise, and then come back to things with a clearer mind, it's amazing the difference in feeling that you can have kind of coming back to your desk after you've exercised. Now I'm going to talk a little bit about the immune response and how stress links with that and what exercise role is in how that plays into the immune response. So I'd like to bring your attention to this slide here and into this J-shaped curve, which shows the relationship between exercise and the risk of upper respiratory tract infections, for example, coughs and colds. What this graph shows is that the most beneficial effects to your immune system come if you go from being a sedentary person to being a moderately active person. So if you're the kind of person who sits around all day and doesn't spend much time walking or doing any formal type of exercise at all, you'd be classed as a sedentary person. But moving to becoming a more moderately active person, where you might do 30 minutes of exercise each day, you are going to have a much lower risk of getting a common cough or a cold. This is due to there being an improved antibody response in people who exercise. But I also have to say the reason for this J-shaped curve is because this protective effect is only protective up until a certain point. So, for example, frequent, exhaustive, high-intensity interval training can actually lead to increased secretion of stress hormones and a decreased immune response. This would classically be people who do really extreme ultra marathon training, or people who spend a lot of their workout time doing like high-intensity interval training. So what I'd really like to stress here is that actually, whilst high intensity interval training can be really beneficial, it's also important to balance that with doing kind of controlled steady state work, such as jogging and maintaining your heart rate at a particular level. So finally, just going on to the next slide about exercise, what are the key exercise recommendations that we would give to managing stress levels? So looking at around 30 minutes of moderate activity per day is recommended to have a positive effect on stress levels. Not only this, but cool downs are essential. So like I was just talking about previously, in terms of the high intensity interval training, this can actually lead to a large increase in the amount of stress hormones that you have in the body, because as part of that exercise response, we need them to kind of prime us for that high intensity workout that we're doing. However, actually cooling down is a really important part of that exercise as well, to make sure that we're kind of recycling some of those excitatory molecules out of our system, such as adrenaline and cortisol. This also can be beneficial from a cardiovascular perspective to help reduce the chance of us getting some sort of arrhythmia in the long run. Mind and body types of exercise can be really beneficial to build into your weekly routine as well, such as yoga and Tai Chi. The reason that these can be so good is because they put a real focus on breathing in through your nose and out through your mouth, and actually focusing on the exhales. It might be something that you can try doing after this session. Really focusing on shorter inhales and then longer exhales can actually massively reduce your blood pressure and also massively reduce your resting heart rate as well. So if you have an Apple Watch or anything and you were to try this activity at home, you could try taking a deep breath in and then really focus on breathing out nice and slowly, and that can help directly impact your nervous system and reduce the heart rate. So focusing on breathing throughout exercise is also important. Jogging and running or any type of cardio-based activity are really great ways to exercise. Getting out on the bike, making the most of the outdoors as well, really good ways to exercise. But overall, I'd just like to reinforce that a combination approach to exercise is very important. So incorporating resistance training, cardio and steps into your workouts are important to be able to achieve your health goals and reduce and manage your stress levels. And finally, you'll be pleased to know that rest is important too. So try to incorporate rest into your day-to-day routine and make sure you have at least one rest day a week. Thank you so much. And now Anna's going to talk about the role of nutrition and stress management.
Thank you, Sabine. So we'll start again with another poll before I start talking, which is, how does acute stress affect eating habits, our eating habits? Does it increase our appetite, it decreases our appetite, or it doesn't make any changes? Okay, 50-50. Okay, so 50% of you said it increases our appetite and the other half decreases. The correct answer is the second, so it decreases our appetite, and I'm gonna talk about that in one of my slides later on. When we talk about stress in eating, it's more about our appetite, so our desire to eat, rather than the hunger. Excuse me. So it's more about our appetite, so our desire to eat, rather than our hunger levels, that are affected by stress. And we can clearly say that there is a bi-directional relationship between the two, because our eating behaviors can affect our mood as much as our mood can have a knock-on effect on our eating behaviors. And in the diagram on the right, although we mentioned a few things already, more specific to when it comes to nutrition and eating under stress, there are some very important changes that occur in our body. Such as increased chances of overeating, decreased chances to exercise, changes in our gut microbiome, inflammation, hormonal dysregulation, and longer term, all these can lead also to fat disposition, metabolic conditions such as obesity, type 2 diabetes, even depression. We do have the stress eating paradox, which basically says that when we are under stress, our body has an increased need for nutrient-rich foods, but on the contrary, we have an increased desire for nutrient-poor foods. And there's different things we can do about that. I will mention that later. I have another complex graph coming, which I don't want to focus a lot on the details. Basically, this graph tells us the complexity between stress, diet, obesity, and behavior. So if we focus on the effect of stress on our eating behaviors and what the different parts in our body this can affect, there is different lines, and the different paths, the different lines have different meaning. The dashed lines indicate primary pathways, and the solid lines secondary pathways. So basically, if we start from the top, stress, we can see it acts through the brain. I explained the different mechanisms, the different axes before. to affect our eating and exercise behaviors, as well as stress-related psychiatric disorders, longer term, such as PTSD, depression. And we can see that under stress, we're more likely, as we said already, to engage into a healthy eating, lack of exercise, which can result in the consumption of diets that are rich in saturated fat, and then that can have a knock-on effect back on our mood, feeling dysphoric. And also down here, we can have changes in our gut microbiome, intestinal wall leakness. This is where different bacteria can easier move, get absorbed in our gut. And we do have physical disorders such as diabetes, cardiovascular disease, physical factors such as the fat disposition, more precisely central in around vital organs that also occur. And there is a complex system here on the top of the right of your screen, where different neurotransmitters, basically inflammatory markers and neuropeptides, are also involved and are present in the gut and the brain, and are influenced by stress via the brain, and they also influence the gut microbiota back here, and physical disorders. So we can see in a binary fashion, in turn, they regulate both eating behavior and psychiatric disorders. We can say that around 35 to 40% of people who consume more food tend to consume more food under stress, whereas the remaining part, the remaining percentage, either decrease their consumption or they do not change their food intake as a response to stress. We also know from the evidence that among the top foods that people tend to choose for comfort are chocolate and coffee. When we experience acute stress, from one hand, we see that there is a tendency that our appetite is more suppressed, whereas under chronic stress, there's an association between an increase or a decrease in our appetite, but definitely there's also weight fluctuations that can occur. And as I mentioned already, there is more chances that we are more likely to engage into consumption of highly processed foods, such as rich in fats and sugar. So more pre-packed refined products, which then can lead to accumulation of fat. And in a nutshell, the increase of, as a response to stress, we see an increase, as Sabine said already, in our stress hormone cortisol, which is then linked with central obesity, which can then lead to insulin resistance and increased risk for diabetes, cardiovascular disease, as well as certain types of cancers. And in terms of appetite, we can see that under stress, there is a decrease in our satiety hormone leptin and an increase in ghrelin, which is our appetite regulating hormone. If we move into the next slide, we can definitely say that either psychological or physical stress, whatever the root cause, can really affect the levels of different nutrients our body is able to absorb and retain. And there is stronger evidence to support depletion of magnesium, zinc, calcium, iron, and some B vitamins when we experience stress. There are some foods, from one hand, and just to wrap up there, I want to start by talking about the different foods that can exacerbate our stress and anxiety levels. So that is caffeine to start with. And I say caffeine because when it's consumed in excess only, and that means the evidence shows that above 40 milligrams a day, the majority of the studies show a significant increase in our anxiety levels. And that's because caffeine as an ingredient, because of the caffeine, it overstimulates regions in our brain that process threat, and also shuts down a gray region that typically helps regulate anxiety. So if we overconsume, we achieve the opposite results. And then we have alcohol, which some of you might have experienced already when you're trying to sleep after drinking some alcohol. There is the disruption in our sleep quality, which can worsen both our anxiety and depression levels, if that applies to us, of course. And then we have the artificial sweetener part, where consumption of artificial sweeteners can increase our bad gut bacteria, and therefore can have a negative knock-on effect in our mood and anxiety levels. More specifically, there is evidence to suggest that aspartame as an artificial sweetener has been more directly linked with anxiety and therefore should be avoided when consumed very regularly or in excess. And then I would like to wrap up by looking into the different foods and nutrients that are stress-fighting foods and nutrients what are those foods that we can consume more to support our body and the different reactions when we're going under stress. So this is, for example, compressed carbohydrates. We all know that that is things like whole grains, fruit and vegetables, so high fiber foods, which are able to boost our serotonin levels, the feel-good hormone that makes us feel calm, feelings of fullness, and give us a variety of nutrients. We also have the omega-3 fatty acids that we get from things like foods like fish and seafood, flax seeds, walnuts, and these support our brain function and serotonin production as well. We do have also the good quality proteins, and by that I mean things like eggs, fish, poultry, unprocessed meats that generally, due to release of tryptophan, serotonin, there is evidence to suggest they have antidepressant role as well, and they increase our cognition and mood. And then following that, we have the vitamin C, foods such as citrus fruit, cruciferous veggies, that is things like strawberries, tomatoes, peppers, and because of these foods are very rich in antioxidants, they are very protective against our immunity, and there is evidence to suggest that they also reduce our cortisol stress hormone levels. And then we have B vitamins, which are found again in rich in protein foods, unprocessed food, but as well as dairy and some whole grains. And the B vitamins are other names for that can be folic acid is one of them, vitamin B12, B5, B6. So there's different types of B vitamins, but as a whole, they also support the development and the maintenance of our nervous systems, our mood, and help us cope with stress overall. And if I move into our final slide, there's a few more ingredients here, such as magnesium, which is found in things like pumpkin, chia seeds, avocado, green leafy veggies, as well as whole grains, tend to lead to muscle relaxation, fatty acid formation, cell production, and they help us regulate our heartbeat when our blood pressure increases. We then got selenium down here, which is found in things like Brazil nuts, whole grains, organ meats, and that is also has been shown to support fatigue, brain and cognitive function. Then we have coffee. I know I mentioned caffeine before, but when consumed in moderation, coffee can be actually very useful because it can make us retain our alertness levels. It can help us with mood and stimulates our nervous system in a positive way as well. Then we have dark chocolate, one of the preferred food to consume after stress, which also has mood boosting benefits because of the increase in serotonin and reduces our anxiety levels. And then the last two, we have green tea. There is an element in green tea called L-theanine, which is a non-protein amino acid, and basically it reduces our stress and anxiety levels as well, relaxes our brain. A lot of people enjoy to have a nice warm cup of tea when they're feeling under stress, and that indeed has a really good impact in alleviating some of the stress and anxiety levels someone might feel. And then we have our probiotics, which are fermented foods that support a healthy gut flora generally and have the potential to alter our brain neurochemistry, treat anxiety and depression related disorders when these are present, of course. And there is evidence for specific strains of, if someone is aware of specific probiotic strains, two lactobacillus strains have also been linked with positive effects on stress. This is lactobacillus acidophilus and lactobacillus rhamnosus, if someone would like to look into that as well. So thank you. I think that's me done here. Over to you, B.
Thank you so much for that, Anna and Sabine. So I feel like there's been a few key takeaways from what you guys have discussed. First of all, that short periods of stress is normal and a part of life, but having chronic stress can have a prolonged negative impact on the body, and that's when we should really focus on managing it. From a fitness and an exercise point, I feel like we've learned that aerobic exercise is really important to build into our daily routine for calming effects on our body. And from a dietetic perspective, that a good variety of different food groups, of good quality foods, and reducing processed foods can be really helpful in reducing inflammation and helping to boost our overall immune system. So thank you so much, Sabine and Anna, for those insights, little snippets there of the many things you covered in your parts. So taking this over to how can Uniquely Health help and why we're covering this topic. So at Uniquely Health, we offer a blood testing service which can test some of the biomarkers related to stress, such as cortisol, which we've discussed today. And we can look at other biomarkers that are interlinked to the impacts of stress on your body and get an insight of the impact of chronic stress on you. Our clinical team, such as including Anna and Sabine, can create an action plan to help you reduce your feelings of stress and focus on areas of nutrition and fitness that you can incorporate to help you. And we do this all in a virtual setting and use our app to help you. So thank you everyone for participating today. But before we go, I know we've had a few questions that we would love to answer, and I'm going to hand over each time to Sabine and Anna. So we're going to start with the first question. Are there any tests that measure cortisol? And as we've just discussed this, yes, we have a biomarker test for cortisol. Is there anything else you'd like to add on that one, Anna and Sabine?
Yeah, that's a great question. So of course we have the blood test we can do, and we can do that through Uniquely Health as well. So there is a specific cortisol blood test. We can measure your levels of cortisol. There is also other methods, maybe if you ask your GP, such as using urine or saliva test. But most likely you're better off with these two options, and that's you have either the blood test, your urine or saliva test to measure that.
Thank you. Okay, I'm now going to move on to the next question, which is, do you have any bite-sized actions that you can recommend to help deactivate acute stress in the moment? Anna, would you like to start with this one?
That's a very interesting and tricky question. Okay, so I'm not sure there is a definite answer to that. My view of it is, when we talk about acute stress actually occurs when it as a response to something as a short-term stressor, as I mentioned. So that can be something that happens suddenly, like an accident or an argument. So in terms of preventing that, we cannot do anything about it. In terms of deactivating the stress response, because we're talking about acute and not something that will lead to pathologic conditions, where things like medications, probably and psychotherapy would come in. Simple things like meditation, trying to find some time breathing exercises, I think is the more the way to go instantly. Going for walks, so physical activity, breathing and meditation is the key things I would say would benefit you after an acute type of stress you might experience. That's a great question. I don't know if someone has anything else to add.
I think just following on from what you're saying there, Anna, I think even 5 minutes of walking can actually reduce your acute stress levels. So taking time away from the stressor itself, if you're in the mix of a work deal or something like that, just taking 5 minutes away from your desk and focusing on those breathing techniques that we briefly touched on earlier can be really beneficial to reducing your acute stress levels.
Thank you for that. Fantastic. Moving on to a next question. Are there any signs and symptoms that differentiate stress from something more serious like depression? Sabine,
Yes, so it's a really good question because there's actually a lot of symptoms and signs that are very overlapping between the two of them. So when we look at stress and depression, there's quite a lot of interlinked side effects such as lack of sleep. You might feel irritable, lots of things associated with mood. And actually, it's quite hard to distinguish between the two. But I think some of the things that do distinguish them is that stress as an acute or a chronic condition can often be managed through certain techniques, whereas depression may be something that you need to be medicated for and you need to seek like advice from your doctor for. I think with depression as well, it's often falls under the category of low motivation. You may feel that you've got low mood, and often much more long term, and possibly management of it doesn't necessarily come down as easy as it may be to manage stress. So it's definitely worth kind of speaking to your doctor if you are worried about this, in terms of like it being more towards the depression end than the stress end, and stress should be more manageable in general than something like depression.
Thank you for that, Sabine. Just to add, on our dashboard, we use the questionnaires of GAD-7 and the PHQ-9, which are questionnaires used to help identify levels of general anxiety or depression, and can be a useful tool for one to see how severe there is and to put a framework around what Sabine was just explaining. And you have that access with us once you register for an account with us. Thank you so much for everyone for all your questions. They just keep on coming in. Sabine, we have another question here. You mentioned stress is a form of exercise. How can you tell if you have pushed yourself too far?
Yes, it's a really good question. So there are actually some really useful tools that come on watches for this sort of thing. So I've got a Garmin just here. I promise I'm not plugging Garmin, but it actually gives you an ability to have a look at your readiness score for exercise again. And Apple Watches can do this as well. I know that Polar Watches can also do this. And sometimes when you finish a workout or a training session, it will tell you how many hours of recovery you'll need. So if it's a light intensity exercise session, it may say that you need to have 12 hours of recovery time between your next session. But if it's something that's much more intense and vigorous, it may be that you need 48 hours, or I think the highest one I've seen on here is 72 hours recovery time needed after something much kind of longer in duration and pushing my heart rate up much higher. So those can be really useful tools, and I would recommend anyone buying a fitness tracking watch because they're great. But also, like I was saying in the presentation as well, just making sure that you're cooling down at the end of exercise sessions. So allowing yourself to take 10 minutes to drop the heart rate down to within about 10 to 15 beats from where it starts at the beginning of your workout session is really important. And like I was saying as well, just to make sure that you're getting rid of that adrenaline and cortisol from your system. If you went from doing a really high intensity workout straight into something else that's perhaps stressful environment, you're still going to have all of that circulating adrenaline, and it's not necessarily good for you to kind of keep that in your systemic system long term. So just making sure that you cool down, taking time to stretch and breathe at the end of a session is also very beneficial. And I would say watches as well, looking at your recovery time on watches, and heart rate variability, sorry, coming to my mind now, heart rate variability as well can give you an indication again of like your readiness score in terms of how ready you are to exercise. So if you've had a really stressful week and you have maybe had more alcohol than normal, you've had less sleep than normal, your heart rate variability will be affected by that, and it will mean that you're not kind of as ready to do something high intensity exercise wise. So heart rate variability is another good tool as well. Which
Sabine, sorry to add, on the app that we're developing, this is something you'll have access and you'll be working with people with, right?
Yes, exactly. So on the app that we're developing at the moment, you'll have the ability to sync your fitness watches with our dashboard. And then as a group of clinicians, we will then be able to talk through what these mean, what these statistics mean, and what we can do to manage those statistics such as heart rate variability.
Fantastic. Thank you. Right, next question. There's two alike questions here. So do we have any specialists on hormonal conditions and imbalances? And also, does the Uniquely Health offer a program for stress in particular, and what does it involve? I will start by answering this, but then I would love for Sabine and Anna to add in their perspective. So at Uniquely Health, our panel that we use for blood work covers the whole series of hormones, including cortisol, which we've mentioned before, but also can have a knock-on effect on other hormones. So for example, if you have high cortisol, you can also then have high prolactin, as an example, and you can see the chronic effect it's having on your body. And through this blood tests, you are able to get an indication on that. So you have that insight. In terms of our specialists, our results are always reviewed by a GP or a qualified medical professional who will have the insights. And then Anna and Sabine, from the exercise and diet perspective, will be able to work with you and take that into account of how to work with your goal. So very important to Uniquely Health is we listen to your goal rather than trying to put one shoe that fits all. It's really understanding what is going on for you. Anna and Sabine, would you like to add anything here?
I think from my perspective, it's just to reinforce the fact that we do work together as a team. Myself, Anna, and our GP will all sit down together and look at the blood test results, and we really want to put the best plan going forward that's going to be personalised and bespoke to you. So everyone's results will be very different, and it's just about finding out what works best for you as an individual. It's going to help manage those hormone levels.
Yep, thank you. The next question is, thank you. Hi team, thank you for the presentation. Could you talk a bit about how the blood tests work? Anna, I feel like this is a great question for you.
Thanks, B. That's another great question. Yeah, sure. So depending on the key areas of work or the key elements, the key markers you want to test in terms of bloods, we do have a panel of, is it 48? Up to 48 different blood markers we can test, and that can involve general blood tests or more specific to hormonal, female or male function. We do have, we can do check on your lipid profile, your thyroid profile, everything, different vitamins and minerals as well, such as vitamin D, folic acid. So we have a very big panel of blood tests we can do. So through the first the call we have with you, we go through, if that's something you want to do, we go through the different needs that you have, and then we can pick the appropriate pack of bloods for you, and depending on your goals and needs that you want to check. There is not just one blood test we can do. There's different blood tests we can do, and then in terms of how we do that, and depending on the panel you want to test, then we can either send you in a lab outside that we collaborate with, that is nearby in your area, or we can send you a blood kit at home, or even a nurse to do the blood test for you. Sorry, B, you wanted to say something.
Perfect. No, that was about what I was going to ask. It's the methods of collection. Thank you so much for explaining that. Great. That is all the questions we had. I don't think there's any more questions that have come through. So I'd like again to thank you everyone for participating. Thank you to Nicola, who you guys have not seen, but has been orchestrating and making sure all the polls and everything work. And Sabine and Anna for sharing your insights and knowledge on stress. And thank you also, most of all, to all our participants. Again, as we've mentioned, if you're interested in our service, you can join our wait list. The link is available on the chat, and with Stress20 you'll get 20% off. And we have other events. Please be in touch if you have any other questions. And thank you everyone for your time.